Okay, welcome everyone. I have Seth Freedman here from Intelligent Observation to talk about the innovators mindset. Seth, talk about the challenge that Intelligent Observation saw and sort of how you approached figuring out a solution to it.
Yeah, absolutely. Thanks, Vic. I appreciate it. So we looked at this huge problem in healthcare about 4.5 or 5 years ago, which is healthcare acquired infections in the hospital space worldwide. So these infections that you get while you're under the care of a hospital that have nothing to do whatsoever with why you were admitted are an overwhelming problem. And it was really how our company started 4.5 years ago, reading an article about just how prevalent, how costly, and how devastating these infections are.
Yeah, there's a lot of deaths just from this. I can't remember how many. You probably know how many.
It's about 100,000 fatalities a year from these infections, which, to give you a perspective, is more deaths annually from healthcare acquired infections than from breast cancer and prostate cancer combined in the US.
Wow. Okay.
So it's interesting. When we looked at this problem, we thought, you know what? Is there one or two or several impetus to try to get arms around it? And it's interesting that there's actually a solution to the problem. The World Health Organization and the Center for Disease Control have commonized, and they figured out that we can actually reduce these infections by about 50% if we simply get healthcare workers to wash and sanitize their hands according to the guidelines that are already established in hospitals today, which is a pretty incredible thought if you think about it. Get doctors, nurses.
First of all, that's 50,000 people a year that don't have to die. And
And
secondly,
about,
the doctors and nurses and med techs have to wash their hands, which I would assume they should be doing already. But
Vic, it's as simple as wash or sanitize your hands. Sanitizing is the term we use for the alcohol-based hand rub that's prevalent everywhere.
right.
It's just following the guidelines that are in place, which, to your point, should be something that's commonly done now, but it's not. According to a number of recent studies, hand hygiene compliance in the US for healthcare workers is between 40 and 50% at best. So we have about half of the healthcare workers each and every day that aren't washing or sanitizing their hands how or when they're supposed to.
Yeah. Okay. So tell me, how did you approach this? I mean, you whip people, or like how do you get them to do it?
Yeah, it's interesting. So we looked at how are hospitals currently managing this particular problem in their facilities. And it was so interesting to us because in an era where technology in healthcare is off the charts and it's incredible, robotic surgeries and four-dimensional imaging technology, hospitals are using a clipboard and a pen to try to manage the problem. And it became somewhat evident to us that this is part of the problem, is that having someone stand in a hallway and observe healthcare workers holding a clipboard and a pen using a manual checklist to see if people do what they're supposed to is not an adequate way to either one.
I do what I'm supposed to when the boss is watching with a clipboard and a pen over my shoulder.
Yeah, it's called the Hawthorne effect. It's a very well-known behavioral effect. We all behave the way we're supposed to when we know someone's watching. And when they're not watching, we go back to our usually non-compliant behaviors.
No. Okay, so how did you approach trying to figure it out?
So we took the approach that there has to be a way to use technology to solve this problem. Certainly a way to replace the clipboard and the pen as a way to manage compliance in a hospital better. And we looked at all of the solutions that were offered that were technology enabled. And 4.5 years ago when we started, there were already a number of solutions that were out there, but they all commonized on one technology platform, traditional radio frequency. And we went through a survey process with customers, something that a lot of entrepreneurs do. And that's basically asking customers about the problem, whether or not they were interested in a solution that replaced the clipboard and the pen, and if so, had they used any of the competitive offerings or looked at them. And through a pretty extensive surveying process, about 150 different hospital customers that we surveyed, we found out that hospitals wanted to solve the problem using technology, but that the existing technology platforms out there weren't accurate enough, they weren't detailed or complete enough, or they weren't solutions that hospitals thought met their return on investment to solve the problem. And that's the avenue we zeroed in on. How do we use a different technology to address too costly, inaccurate, or a complex solution?
Okay, so that's the problem set, that the existing solutions were expensive and not very reliable. And so
Correct.
what did you come up with? Did you invent a new thing?
No, we didn't. We did one better. We found an existing technology to use as opposed to inventing one from scratch. And it was actually sort of one of those aha moments where I went to look at a car to buy, and the car that I was looking at actually utilized the push button ignition with a key fob that you put in your pocket or your purse. And it was really interesting. I was sitting in the car and I had the key fob in my pocket and I could push the button and start the car, and it was great. And when I got out of the car and I stood next to the car with the door closed with the key fob in my pocket, and somebody in the car tried to push the button, the car didn't start. It was actually centimeter level proximity detection technology. It's called near field magnetic induction. It's been used in the automotive industry for a number of years. And it was one of those, you know what? This technology may work in our use case. And the more we got into the technology, the more we realized it wasn't just the accuracy of this technology that was far superior, but things like battery life, cost, simplicity of acquiring the hardware that's involved with the technology were all attributes that enabled us to put together a solution that was dramatically different than anything before us.
Okay. And so have you got it live and working? What's the progress report?
We have, yeah. We've taken somewhat, I guess it's sort of the traditional healthcare entrepreneurial path where you develop a minimal viable product, you put it into a hospital, you pilot, and you iterate. And we've done that actually 4 different times over the last 4.5 years, which led to the completion of our first commercial version of the product. It was finished the last quarter of 2019. And so we're really pleased to be able to move from piloting product to being able to sell product. And we're happy to count among our first customers, Johns Hopkins, the thought leaders in our space in infection control worldwide, and also HCA, Hospital Corporation of America, the largest chain of hospitals in the US.
Yeah. Wow. So, and then it feels like this time, I mean, my wife and my kids and everyone are really focused on hand washing. It seems like the hospitals are going to need to be much more attuned to that right now or very quickly.
Yeah, I think, a few things with the times that we're living in right now. One, hand hygiene compliance for all of us has become much more top of mind and much more topical. And hospitals are no different. They're realizing that the way to manage these infections already exists. It's guidelines that they already have developed and have already put into their facilities. It's how do we best manage the compliance of those guidelines? Definitely top of mind right now.
Yeah. Okay. Well, thanks, Seth. Really appreciate it. Keep going. Get everyone's hands clean. Stay safe there. I appreciate you sharing the story with us.
Stay safe as well.
Yeah. Okay. Appreciate it. Thank you.